Awesome. Well, welcome everybody to the orientation for family attendees of the 2026 ASXL Family Conference in Michigan at the end of June. We're so excited to have lots of folks here, including folks we know are registered and planning to come, and perhaps some folks that are considering attending. Today's presentation, we're going to cover all about the conference, what to expect, and at the end, we'll hear from some of our research team members who are going to talk a little bit about some of the research opportunities at the conference. So my name's Amanda Johnson. I'm the executive director of the ARRE Foundation. I've been with the organization since 2021. I was the organization's first paid staff member 5 years ago now, and this is the third conference that I've been a part of planning. And then I'll let Sarah introduce herself as well.
Hi, everybody. I'm Sarah, and I'm the Family Education and Engagement Coordinator for the ARRE Foundation. And I'm also mom to Sammy, who's pictured here in this picture. He has ASXL2, Shashipania syndrome. So I've been with the foundation for about a year and a half now as an employee, but was a parent volunteer from pretty much the beginning. And this will be my fourth family conference that I'm attending as a parent and my first as staff of the ARRE Foundation.
Awesome. Thanks, Sarah. Karen, can you introduce yourself as well?
Hello, everyone. I'm Karen Ho, the Chief Scientific Officer for the ARRE Foundation. My background is in genetics and developmental biology, and I have experience in diagnostics and drug development.
Wonderful. Thanks, Karen. All right, so I'm going to talk for the first chunk of the presentation here, and then we'll turn it over to Sarah. And at the end, we'll hear from Karen, and she will introduce the members of the research team who will do the second half of the presentation here. So as I said, we're going to cover all things about the ASXL Family Conference, including the meeting location, what to expect, some other tips as you plan your travel, and then a reminder of some important dates. Then for the second half of the presentation, we will turn it over to the research team to talk about the different research opportunities at the conference and what that entails. And at the very end, we will take your questions. So we'll ask you to hold those at the end, or if it's something quick, you're welcome to pop it in the chat, and the team can try to answer in the chat as we go along as well. So a quick overview of the conference as a whole. It is a 4-day event. It's really two different pieces sort of put together. So the first day and a half is a research symposium for the professional community. So this includes researchers and doctors who get together to talk about all the latest science and clinical research in the ASXL community. And then we kick off sort of the combined event starting Friday night, which is when we do our ASXL community celebration dinner for both groups. So this is a really fun superhero themed dinner that we'll talk a little bit about later in these slides. That's on Friday night. And then really on Saturday, the conference programming for families really kicks off in earnest with an all-day program on Saturday and half-a-day program on Sunday. Very importantly, you'll see across the top of this slide here that research appointments are offered for all 4 days, Thursday, Friday, Saturday, and Sunday. As you'll hear from the research team, there's a lot that goes into planning these appointments, and it's a pretty significant time commitment for people who are planning to participate in research. And so if your travel plans allow, we really encourage you to think about coming as soon as possible to help make sure that we can accommodate everybody across the days of the conference. And we'll talk a little bit more in a few slides about what's available for you to do outside of the family programming if you're there for research on Thursday and Friday. So this is a quick schematic of the floor plan of the Sheraton Ann Arbor, which is where the conference is going to be. If you've been to the conference in the past, we've been in a couple of different locations, so we're really excited this year that we are in one building for all parts of the conference, including where all the sleeping rooms and guest rooms are for folks who are staying here. So I think this is going to be a really great experience for everybody to be all tucked in one location and not have to change locations for different parts of the meeting. So you can see off to the right, there's a little yellow box that says hotel check-in. That's the actual place where when you get there, if you're staying at the hotel, you'll check in there. And then there's this whole other wing where you see all those orange squares, which is where all the meeting space is. So that's the part of the building where we will be for the actual sort of programming and that sort of thing. And then you'll see in the lower section, we are using some guest rooms for research space as well. So we've got a big footprint across the first floor of the hotel there. And I think that's another nice feature of this location and one of the reasons we chose it. Everything everything is on the first floor, so you don't have to navigate different floors to participate in different aspects of the conference. So when you get there, the first thing you'll do, if you're staying at the hotel, you can go check in, get your room key, that sort of thing. And then the next thing you should do is come to registration for the conference. So this is where you'll check in with the ARRE Foundation team. You'll get your conference packet, which will have everything you need for your family. It has an agenda. We've got some cool notebooks this year. You'll get the badge for each member of your family, your name badge, and we have our conference shirts. You'll get all of that at registration. We probably have a little bit of paperwork for you to do while you're there, including signing a liability waiver and photo release. And then if you're checking in for research, there's a separate location where you'll go to do that. And we'll point you to that. That's closer to the actual hotel lobby. So that's in a separate space this year. If you were at the 2024 conference, those things were right next to each other. This year, they're a little bit separated. So we'll point you to where you need to go to actually check in for your research appointments, and you'll get a different packet of information there with the research teams, which they'll talk about later. And I'm going to hand it over to Sarah to talk about the Family Lounge.
Yeah, so something that's really reassuring for families to know is that we have a family lounge that's open 8 to 5 each day of the conference, both while the main programming is happening and then during the downtime as well. And this place is just going to be a sensory-friendly place for you to hang out with your child. We're going to have toys and snacks and activities and crafts. And something that's notable is we will have an adult size changing table with supplies that you will need. And it's a private area with a place to wash your hands. So I'm so excited about that. And for us parents who have our loved ones in diapers still, that's a priceless commodity. One thing to note though is there's no supervised care in the family lounge. So it's very important that your loved one be with a caregiver who is familiar with both their medical needs and their what behavior support they might need. And then the other thing to let you know is that we're going to have programming that's happening at the same time as the main programming. So one of our goals was for caregivers who weren't able to participate in the main program because they were either a part of assessments, their loved one needed a break from that area. The Family Lounge is going to have its own programming. So everything from having a physical therapist come in to help support families with safe transfers as we're aging and our loved ones are getting bigger. We're going to have an equine therapist do a presentation, visits from both therapy bunnies and therapy dogs, and even some programming for siblings. So we're excited about that additional programming that'll be happening. Yeah, and so this is just kind of an overview of the main programming that's going to be offered. You can also find this on our website. So the on Saturday we will have programming as a group, like in the main session, hearing from our medical and scientific advisory board and some parents and providers who can give us some insight into ASXL-related disorders. And then in the afternoon, we'll be dividing by ASXL disorder into workshops, 3 workshops that'll be happening at the same time, and we'll be alternating. We'll explain that a little bit more in detail, but so you'll be with other parents whose kids have the same disorders as your child, and you'll travel in workshops with them through the 3 different workshops. And then on Sunday morning, we're going to do a remembrance session for ASXL loved ones who have passed away, and then hear from a gastroenterologist who specializes in motility challenges, and then a neurologist who specializes in neurogenic conditions. And then our closing keynote on Sunday is Amanda Griffith Atkins, who's actually a licensed counselor and a rare parent herself. And she's going to be sharing she's going to be our closing keynote speaker. So really excited for our program. So this explains what I kind of bumbled over in explaining the workshops. This is a good visual. So it's 3 rotating workshops. Again, families are divided by disorder, and each workshop is going to be an hour with breaks in between. So the workshop topics are what's missing from this list. So a crowdsourcing a session. If you've ever looked at the symptoms list of your child's ASXL related disorder, I'm sure you can see things that are missing. And so that's our goal, is to hear from parents and caregivers of what they feel could be connected to their child's disorder. We're going to have a session called Caring for the Caregiver, which just is going to focus on the unique needs that parents and caregivers have, and both their physical and emotional needs. And then we'll be doing a PCORI workshop, which is as well, which we're having parents give their feedback on developing a severity assessment for ASXL disorders.
And I put this little asterisk on the slide to remind me to say that I think the research team is going to talk a little bit more about this in their presentation as well. So you'll hear a little bit more about this later in the slides.
Excellent. So how to read the schedule? Like I kind of explained, there's concurrent programming. So our general session, that's like the main education session, that's going to be in the room called the Grand Ballroom. And then the other programming, which is like hands-on workshops, the special activities, character visits, Stripey and Captain America are going to be visiting us. It's important to note both like the time that the other programming is happening and also the location. So some of it will be in the family lounge, which is also called the petite ballroom, or some of it will be in the breakout room, or like when the therapy dogs come, they're going to be out in like the lounge area. So make a note of where it's located. And then this is an example of that concurrent programming. So 9 to 10, the general session is in the grand ballroom, where Amanda's going to be making her opening remarks. And then the other programming is in the petite ballroom, where the family lounge, where we'll be having a music therapy session. So both things will be happening at the same time. And then other things to note, on Saturday at 5:45, we're going to do a group photo. So we're going to provide everyone who attends with a conference t-shirt, and we ask that you wear your shirt at that time, and we'll do a big group photo. And then an option that we're providing for families this year is a personalized trading card. So you can see an example of that here. And the idea of this is to help families have a way to connect both during the conference and after, with families or clinicians, researchers, whoever you would like to share your trading card with about your child and your family. Just kind of a fun thing for the conference this year, and that's optional. And then Amanda Griffith Atkins will be offering a book signing on Sunday morning. And then we have some tentative sessions. So we're still working out the details for these, but we're hoping to provide one-on-one genetic counseling sessions, office hours with a GI specialist. So this would be a time where you sign up to meet one-on-one with a specialist who has actually treated someone with ASXL related disorders before, which is very unique. I've never experienced that. And then those details will be sent after your research appointments are confirmed. So we want to make sure our number one priority is having your child signed up for all of their research appointments, and then all of these other things are added on bonuses.
Thanks, Sarah. So I'm going to talk a little bit about registration. So as I mentioned at the beginning, this meeting is really two different pieces in one. We have our ASXL Research Symposium for clinicians and scientists, and then we have the ASXL Family Conference Programming. So that's the piece that you all are registering for. So when you go to the website to register, that's what you'll see in terms of the option that you want to choose is the ASXL Family Conference Program. And that does include a lunch. Lunch is provided on Saturday, and then we provide coffee breaks and snacks on Saturday morning and afternoon, and then on Sunday morning as well. The registration rates are $50 for a child and $125 per adult. We do have early pricing that is on offer right now. It is through May 15th. And you can see on the screen there's two promo codes that will either give you a 90% discount or a 50% discount. And those promo codes are Family 90 or Family 50. This is all laid out in more detail on the conference website, but really just want to emphasize that May 15th deadline, which is now just about 2 weeks away, if you would like to receive the discounted rate. And you can choose either the 90% discount if that works best for your family, or you can pay full price, which is of course helpful to helping make sure that we can cover the costs of the conference. But we offer these different rates to help meet families where they are and encourage them to attend. So a couple of other bits of information and tips. So in addition to registering for the ASXL Family Conference, there are two additional add-ons that have an additional registration fee. That is the dinner on Friday night, the very, very fun superhero-themed dinner. You can see a picture from last year here. Everyone is encouraged to dress up as much as you would like or as little, and it's a really fun event with the entire ASXL community. So that's a separate registration. And then we also do pizza and a movie night on Saturday night, which is very casual, sort of a pizza and salad buffet, a place to show a movie with seating on the floor and then tables and chairs for adults to connect while everybody else is watching the movie. So our couple of registration tips here is just a reminder that everybody who's coming to the conference needs to be registered for each component they're planning to attend, regardless of their age. Everybody from infants all the way on up through grandparents or other caregivers who are coming with you, everybody needs to be registered. We also recognize that the registration form is pretty complex, and that's because we're collecting a lot of information about each person. The name that you want on your badge, the size t-shirt you want, if you have any dietary needs or other accommodations. So our suggestion is that if you can, to try to complete that registration form from a computer, just because it's pretty complicated and lengthy, and you have to provide that information for each person in your party. So take your time and plan time to get that done in advance of the May 15th deadline if you're planning to use one of the reduced rates. And I'm going to hand it back to Sarah to talk about some of the accommodation.
Sorry, forgot I muted myself. So like Amanda pointed out earlier, our accommodations are going to be at the same place where all of the research happenings are happening. So that's going to be at the Sheraton Ann Arbor. We have a room block for $169 a night. So those rooms have either two queen beds or one king bed. One very exciting bonus that I'm excited about is we get breakfast vouchers from the hotel restaurant, and I got to eat at this breakfast and it's very yummy. So every room that has a king room gets two breakfast vouchers, and then the queen rooms get four breakfast vouchers each day. And then we're also providing free on-site parking for families. What's really important is that you book your room by June 1st using the group booking link. And after that, both the reduced rate and the bonuses are gone. So make sure you do that before June 1st. And then they do have accessible rooms. And when you're completing your booking, you can mark that you, for whatever accessibility that you need. But we also recommend calling the hotel to confirm that after you've booked it, just to make sure that they have that noted so that you can receive the room that you need. And then planning to get to the Sheraton. So the closest airport is in Detroit. And there is no direct public transportation from the airport to the hotel. So there is public transportation that'll take you to downtown Ann Arbor, but then you would need to also find an Uber or a Lyft to get a ride from downtown Ann Arbor to the hotel. So something to consider when you're planning your budget for traveling. So we do recommend, if possible, for you to rent a car for the families who can drive. We recommend driving. But yeah, something to consider when planning your trip. And then see the website for wheelchair accessible transportation options. All of that needs to be coordinated in advance. And then something to know too is that where the hotel is, it's kind of like it's a lot of different hotels, like all in one area. So there's not really like sidewalks to be able to walk places. There are some restaurants nearby, like the hotel has a restaurant, but then there's a Wendy's, Buffalo Wild Wings. So you can check it out on our website for additional options as well. But all things to consider when you're making your plans.
Yeah. And on that website too that Sarah mentioned, we've also put a list of nearby pharmacies, other retail stores, other things that you might need to access while you're there with the driving distances and addresses for each of those. So all that information, including everything that Sarah just mentioned, is all on the conference website now.
Yeah, and then something that every parent of someone who's medically fragile has to consider is what do we do in an emergency? So obviously with any medical emergency, you're going to call 911. But we are very fortunate to have Mott's Children's Hospital very, very close to where our conference is. And this is a phenomenal hospital with excellent specialists to care for your child. And then the University Hospital is there as well for adults. Both of them are located about 5 miles from the conference venues.
Great. And then I'll also mention here too, we offered this at the 2024 conference, and that's what's noted here on the slide. So if your child does get admitted to the hospital for any reason, we have our shared phone number that's here on the screen, that 207 number that connects to myself, to Sarah, and some of our other staff. So once your child is under the care of someone at the hospital, you're welcome to text or call that number, and the ARRE Foundation team can do what we can to try to connect you to some of the other clinicians who are there at the conference, who are very well versed in treating individuals with the ASXL conditions and can try to help troubleshoot if you need any additional support from there. And the one note is that that number is not monitored 24/7, so we'll get to you as soon as we see your message. But if it's in the middle of the night, we may not catch that right away. So that's sort of a backup additional option. But as Sarah mentioned, 911 is always your first best bet.
Is this me, Amanda?
That's you, Sarah. Yeah.
Okay, sorry. And then where to find additional information. Our conference website, asxlconference.org. It is jam-packed with all of your FAQs and all the information that you could possibly need. We have a private Facebook group. So if you haven't already, request to be a part of that Facebook group. And you can put your questions on there or see questions that other families have asked. And then that's also a place to kind of connect or meet with other families ahead of time. And then we'll be sending out emails 1 week out, and then 1 week prior to the conference, we'll be sending emails with more information. And then daily morning messages Thursday through Sunday during the conference with information you might need that's pertinent for that day. And then if you're still stumped or you have more questions, you can always email us at info@arrefoundation.org or call or text us at that phone number 207-881-8080. And then important dates to know. We can't stress this enough. The early registration deadline is May 15th, which it felt like a long time ago, not that long ago. And now it's coming very quickly, especially with all the busyness of May and the end of the school year and teacher appreciation, all the things that get piled on us. So we just encourage you to register as soon as possible. And then again, the hotel reservation deadline is June 1st. So again, booking your room as soon as you're able to, so important. And then June 1st is also our enrollment and onboarding deadline for research participants. So that means contacting the team, going through the interview, filling out all the forms, and having everything set by June 1st. And our research team will explain a little bit more about that. And then the registration deadline for the conference is June 15th.
Thanks, Sarah. So we'll let Karen finish our section here and hand it off to the research team.
Great, thank you. So in case you came late, my name is Karen Ho. I am the Chief Scientific Officer of the ARRE Foundation, and I just have two brief slides to introduce our research participation options to you. Before I do that, there was one small thing that I did want to mention about our family lounge. That Sarah very nicely introduced to you and told you that there's going to be lots of activity there. And in fact, there will also be a genetic counseling student from the University of Utah who is volunteering her time to work with the ARRE Foundation to enrich the questionnaire that we currently use for the natural history study. She might approach you and ask you if you wouldn't mind giving her some feedback on some of the questions that she's developing. Now, I know all of you have probably experienced this where you've filled out a lot of questionnaires and maybe you have very valuable insights on how to build an effective questionnaire to get information that we would like about your child in an efficient manner. So if she does approach you, her name is Rachel Bracewell. And yes, we do know that she is there and she's authorized to ask you some questions. So we would be very grateful if you give her some feedback on her questions. Okay. So simply, this is a slide to introduce the research participation options. I personally am very excited about this because foundations like the ARRE Foundation right now are the driving factor in improving clinical care and in finding treatments for children with rare disease. So what you are doing by participating in research is critical to this mission. And I know that it takes time and it takes sacrifice from your family. And I just want to say thank you for doing that and for sharing our vision that we can make the world a better place, not only for your own child, but for all the children in the ARRE Foundation community by driving the research forward. Okay, next slide, please. And so now it's my pleasure to introduce the lead researchers that are going to be leading the clinical studies at the conference and these very exciting projects. First, I'll introduce Bianca Russell. She is of UCLA and she's running our natural history study, which is absolutely critical for pharmaceutical development later. We have Dr. Rajuda Wilson with us, also from UCLA, also a lead researcher in motor phenotypes, and she will be there collecting motor phenotypes about your children through the CHAMPION study. And last but not least, Natasha Ludwig, Dr. Natasha Ludwig from the Kennedy Krieger Institute and Johns Hopkins School of Medicine, who is running the ALPS study on neurodevelopmental behaviors and phenotypes. And it is Natasha who will be leading this discussion, so I'll hand it off to her.
Okay. Hi, everyone. Just give me 1 second to share my slides. So exciting to see you all here. I see many familiar faces and names, and some new folks as well. So nice to meet you. My name is Natasha Ludwig. I'm a pediatric neuropsychologist here at Kennedy Krieger. I also am the older sibling of a 34-year-old with ASXL-related disorder, Bainbridge-Roper syndrome. So I'm really excited to be a part of this research team. Can you see my slides? Awesome. Okay. So I did want to say there's a lot of dates and a lot of information and a lot that we're asking of you guys. And so I did want to put a plug in for a research guide that the ARRE Foundation developed. It has a lot of information about research participation, the first steps to getting involved if you're interested. And this is actually on the website. And Amanda, I don't know if you're able to put maybe the link for it, maybe in the chat, just so folks have an easy way to access that, because I didn't put it in the slides and I just wanted to mention it. Okay, awesome. Thank you. So we're going to talk a lot today about the different research studies. And towards the end, we'll talk a little bit about the process and how to get involved if you aren't already. Okay. Okay, so first I'm going to talk a little bit about a study for caregivers, clinicians, and researchers. And so this is a study, we were fortunate enough to get an award from the Patient-Centered Outcomes Research Initiative, or PCORI. This organization is really focused on better understanding what outcomes are and areas of research are most important to patients and families, right? We want to make sure that we're doing meaningful research. And so this award allows us to bring patients, caregivers, clinicians into the fold, into making research decisions along with us. And so one of the projects that's part of this award is called the Severity Scale Development Project. And we're going to be holding one of the workshops that we're holding at the conference will be focused on better understanding, what does severity look like in ASXL-related disorders, right? So how do families, clinicians, and researchers view ASXL disease severity? This is really important to help us develop a measurement tool to assess disease severity for clinical care and research purposes. And so we really want to get feedback from you all. And so the first part of the presentation or the workshop will be a presentation about severity assessments, why we need them, the different ways we might use them. And then it will be focused on soliciting information from you all about what makes ASXL more or less severe, right? And which aspects of the condition are meaningful and relevant that we should include in a severity assessment. Okay, and this is offered to all families, but participation is voluntary. It is a research study though, so even though it's a workshop, whoever is in the room will provide oral consent to participate. We will be recording those sessions so that we can go back later and transcribe everything that we learned from you all. It's also valuable, right? We don't want to miss anything. And we'll be actually coding that information so that we can make kind of sense of it all together. Everything will be de-identified, of course, afterwards. We're only going to store de-identified information. And just a quick note that, all caregivers who are over 18 years old can attend the workshops. However, we wouldn't allow any children to attend. And that's for a number of reasons, confidentiality, but also we may be talking about pretty sensitive topics. And everybody has a different level of understanding with an ASXL-related disorder. And so we just want to be mindful of that. So if you have any questions, there'll be other programming kind of going on, the lounge, right? And so there'll be activities and things for children to engage in. But we just wanted to say that up front. Okay. So that study was for caregivers, clinicians, researchers. The next few things we're going to talk about are related to studies specifically for individuals with ASXL-related disorders. Okay. And so really there are 3 primary studies going on at the conference. And all of these studies feed into our ASXL related disorders natural history study, which is run by Dr. Bianca Russell, UCLA. And so I'm actually going to turn it over to Dr. Russell. There you are. I'm going to turn it over to Dr. Russell just to give a brief explanation of what the natural history study is and also the biobank as well. And Dr. Russell, on the next slide, I do have your slide on the biobank sample collection, which I can advance to if you want to talk about that while you're on.
Okay, perfect. Thanks. Thanks, Natasha. So I'm Dr. Russell, for those of you that I haven't met yet, and I've been studying the ASXL disorders since about 2012 when I was a medical student. So it's been a long time, and it's been so amazing to see the community come together and to see the formation of the ARRE Foundation and how far we've taken things. And so starting way back in my medical school years, when I first met the first couple of families with boring open syndrome or ASXL1, I realized pretty quickly that we needed to have a way to capture all of the information that families were sharing. It takes a long time to get things published and put into the literature, and then doctors and healthcare providers to access that in the clinical care setting. But it was obvious that we needed a place to start to collect that information that families were sharing long before it would be published and accessible as research. So I started in residency collecting information on families, and that project has grown into this natural history study and the biobank. And so we've been collecting data on individuals with ASXL disorders since since families started coming to us. And it's been really exciting to see how that's grown. And so it's grown in a lot of different directions. A lot of it has been through collaborations, and you're going to hear more from Dr. Ludwig and Dr. Wilson, who have been two major collaborators on the study, and they've helped expand the type of data that we collect in the natural history study and really grow in a positive direction. We have really grown the depth and breadth of the data that we collect and how that can impact patient care as well as research. And then the biobank is sort of a sub study within it where we collect biologic samples, and I'll go into some more details about that. And that data is all sort of linked and connected with the clinical data that we also collect through the ALPS study, the Champion study, and the natural history study. Can you do the next slide, Natasha? So besides the Champions and ALPS, which you're going to hear more about next, we're collecting samples for the REACH Biobank at the conference, and this is a big effort for us, and we've had a really good response in the past when we've collected samples at our conferences. We're hoping this will be the biggest, best one yet, and I'm optimistic that it will be. So we have the option at this conference to collect both blood and skin, or what we sometimes call fibroblasts. The blood is pretty straightforward. We collect 3 tubes if we're able, with a maximum of 15 mLs, which is a very safe amount of blood to be taken from any of our participants. If there are concerns that it's a small baby, for example, we will talk to you about that, and there's a potential to take less, but 15 mLs is a very safe volume of blood from even young children. So there's the option to donate blood, and there's an option to donate skin. This is a less familiar procedure for most people compared to getting their blood drawn, but I want to reassure you that it's actually very safe and relatively easy. Unlike blood draws where you have to find a vein and make sure that you can get it, skin is easy and accessible, and the procedure itself is pretty straightforward. We are able to numb up the area first, and so it can take a little bit of time while we wait for the numbing cream to work, and we still make extra sure that the area is numb and do a lidocaine injection into the skin. So that's the part that hurts the most, is that little pinch with the lidocaine, but with the numbing cream on the area before we do the lidocaine injection, even that is minimized. And then the actual skin biopsy part here, we're showing in the pictures, is about 3 millimeters in size. So it's about the size of a pencil eraser. And we have a tool that just has a sharp circular edge and pushes it into the skin. We often do the upper arm, but we can do the thigh or other parts of the body as well. And that's something that we would discuss at the conference based on your location preference. But once the sample is removed, we send it to the lab for processing, and we don't do any stitches or anything. It heals up very nicely. It will leave a small pock mark, sort of like a chicken pox scar, or if you had a TB inoculation. In some countries do sort of an arm TB testing or vaccination. So it does leave a little bit of a mark, but it generally heals very well with low risk for complications, and those just being things like infection or irritation at the site. So we're really looking forward to families communicating with us and learning more about the procedure. My goal here is for you to hopefully feel like this is something you would consider. And then we look forward to answering more questions about it that may be specific to your family to make sure that you're comfortable with the procedure. We're hoping we can collect samples on everyone who's willing to donate, both unaffected family members and siblings, as well as those with ASXL disorders, but we also may have some limitations depending on interest. So we will look at sort of our total interest level and then be in touch with you about families that can qualify for sample donations. I think that's it.
Okay, great. Thank you, Dr. Russell. Okay, and so as I mentioned, all the research that's being collected at the conference goes back into that natural history study. And so the study that I lead is called the ASXL Behavioral Phenotyping Study, and that's looking at neurodevelopment and is available really to anybody of any age with an ASXL-related disorder. And then we have Dr. Regina Wilson here as well, who's the lead of the Champion Study. So I'm going to turn it over to her for a moment just to talk a little bit about her study.
Hi, everybody. Thank you for having me here today. My name is Regina Wilson. I am a pediatric neurologist trained in neurodevelopmental disabilities. I'm a clinician and a clinical researcher. As a clinician, I take care of many individuals actually across a lifespan, despite being a pediatric neurologist. So from early infancy all the way through adulthood, and important to this conversation, particularly many individuals with neurogenetic conditions where neurodevelopmental disabilities, complex medical neurologic issues are present, and I treat and manage those patients and work with their families. As a clinical researcher, you heard a little bit from Karen. A large part of our clinical research focuses on motor function or movement because this is often impacted across the board in many individuals with genetic conditions, and not only in terms of delays in walking, but really even the way individuals have gained independence or support their daily living skills, right? Feeding oneself, getting to other places, transferring your own body. And so, although our lab really focuses on that, one goal is to use really sort of unique tools that reduce the cognitive level or intellectual level needed to conduct tasks and really are inclusive of individuals that are more profoundly impacted, right? Those with severe intellectual disabilities, severe mobility issues, but to best ascertain their motor function in a way that we really understand what they can and cannot do. Within that, though, which Natasha, Dr. Ludwig will talk about a little bit more, is we do broader developmental assessments as well. And that's really nicely where we've come together with the ALPS study. So I'll talk more about the Champion study, I think, as we move through the slides where you can have some concrete information. But this study is enrolling kids with what we call chromatinopathies or chromatin modifying conditions, of which the ASXL-related disorders fit under. It is a broader study, but we've been focusing, since it's funded by the Simons Foundation, on kids who are 1 to 5 years, 11 months within this study. And working together with the ALPS study, you'll hear how we are really focused on motor examination, but be working together to collect other developmental assessments. Natasha, do you want me to go into detail in that now or wait until your upcoming slides?
Maybe I'll go ahead and start talking a little bit about, the different appointments, and then I'll ask you to jump in for the neuro exam part. Is that okay?
That sounds totally great. I'll just say one quick thing is this is
Yep.
my third conference, ASXL conference, working with this incredible community and the ARRE Foundation team, and particularly Doctors Ludwig and Russell. So I'm excited to be here for a third time.
Thank you, Dr. Wilson. Yeah, it's been a joy to collaborate with these two. We've really done so much in a very little time, and it's exciting to see where we'll go. Really, as I mentioned, we all are working together, right? And so we don't want families to have to repeat assessments or repeat questionnaires at the same time point. We want to share data, and that's why we're putting all of our data into that natural history study, and that can be connected to the biosamples, right? And so we can understand with different variants, what the phenotype or what the child individuals may look like in their daily life in terms of their development and their functional skills. And so that's our goal, because really we don't know so much. We're starting to understand what the different symptoms of these disorders look like, but we really don't know what does neurodevelopment look like and what does it look like across the lifespan, right? And that's really, really important for clinical care, right? Prognosis, informing families, educating families, but also for developing new treatments, right? And studying treatments and whether they're effective or not. And so that's really the goal of much of the work that we're doing. Um, and so at the conference, if you do participate in in-person data collection, your child would participate in several appointments, okay? And so one of those appointments is a 3-hour cognition communication session where your child would be in the room, and you can be there as well. One caregiver can be in the room as well, and would be doing different play-based activities, like playing with a ball or playing with a puzzle, or answering word games if they communicate verbally. It's a long session. There's lots of room for breaks in there. We are very flexible. Um, This seems like a lot what I'm about to share with you guys, and it is. But we were really successful at the 2024 conference. Families really rallied and participated in as many sessions as they could, and we got a lot of amazing data on about 30 kids. And so we're really, really excited to continue. For the families that participated last time, we're excited to see you again to see how we're developing over time. And then for new families, we're excited to get initial data and meet your child. Okay, so there's that cognition communication session. That's the longest session. Then we have an autism symptoms session where we're going to look at different symptoms of autism. We know that children with ASXL-related disorders may be at higher risk for autism, and so that's why we've added this assessment. We also know that children with genetic conditions are also at an increased risk for vision differences. And so we do have one session focused on understanding visual processing, particularly looking at symptoms associated with cortical vision impairment. So this isn't like an optometry or an ophthalmology exam. It's more how does your child use vision functionally in their world around them. And then we have the neurological and motor exam session, which I'm going to turn it back over to Dr. Wilson, and you can describe a little bit more about that session.
Yeah. I'm sure as many of you are familiar with, individuals with ASXL related conditions do have neurological manifestations, right? So lower tone, maybe more tight muscles, slower to walk, delayed walking. And so in the neurological exam and motor room, we're going to be doing a couple of different things. One, you'll meet with a neurologist, either myself or Dr. Selena from Kennedy Krieger Institute. We will do a very relatively straightforward neurological examination that can be done in the room. There's nothing invasive, generally what you see in the clinic, although we really try to make sure we get all of those aspects, looking at eye movements, looking how someone moves. Probably the most sort of what we call invasive would be checking reflexes, which as a neurologist we love to do, and we're pretty good at getting across different individuals. From the neurological examination, you're also going to participate in two things with two of our research coordinators from the study. Jeff Anderson, a graduate student researcher, and Serene Wong, who actually was at the 2024 conference and met many families at that time. One of the assessments we're going to do is we're going to see how your child walks. So we have two video cameras set up. We show you exactly how to walk alongside them, and we're going to capture some passes back and forth of walking. The other session we're going to do is we're going to have two video cameras set up while your child goes through a series of what we call doing things with their hands, like adaptive function, picking up a piece of food and eating it, picking up a cup and drinking out of it. Now, again, recognizing if they're not able to do those things, we don't try to get those aspects, right? So this is for gait. It would be individuals who are ambulatory walking independently by themselves or with an assistive device independently. For the upper extremity battery, for looking at eating, picking up cup, we also have modifications for helping the individual. But this are video assessments of that. And then we'll have a few different questionnaires where really myself and Dr. Celine will be watching all of the assessments happening, kind of talking to you and filling out a lot of those questions about how your child moves, how your child sees, how your child uses their hands. There might be areas where we have to ask you some additional questions, and you'll see that based on the questionnaires. But given what we'll see in the room, we'll be able to do that. The last component, and I'm not sure, Natasha, if we should describe Heather's area or how do you want me to describe that for now or, okay. So a likely last component within the room, which we're working out some of the details, which was actually done at the 2024 conference, is we have an incredible physical therapist, Heather McLean, who actually presented her work at the scientific ASXL meeting, where she did a motor assessment, we call it the PAMS, which looks at a lot of these from a physical therapy perspective of how a child moves their body functionally and in different positions. So that will all happen within one room, one individual at a time. As Natasha said, we've done this before. We know when to take breaks. We know how to make it most comfortable for the individual. Mm-hmm. Anything I'm missing?
No, I think that's great.
Okay.
Thank you.
Okay. Yeah.
And then I'll just share. So that's all in person at the conference, what we just described. And then there's also a remote component. And so so we will schedule interviews with you. If your child's between the ages of 1 to 5 and hasn't participated in the Champion study before, your interview about adaptive functioning will take place before the conference. and we will let you know when that is, and we'll schedule that with you. But if you don't meet those criteria, your adaptive functioning interview would be after the conference. And this is just about an hour to an hour and a half. Of asking you questions just about how your child's, functions in the world and how their independent skills, and what they can do on their own. And this has been really, really helpful for us for understanding kind of overall functioning. And this is something we try to repeat each year with everyone who participates in ALPS. And then additionally, if you're new to the study, we also will be conducting another interview with one of our amazing behavior specialists here at Kennedy Krieger, which will take about an hour or so, just asking you some questions about any problem behavior or difficult, challenging behavior. We know that in ASXL-related disorders, challenging behavior is one of the top priorities for treatment. And so that's why, we've added this in. And truly, the whole study is designed, both ALPS and Champion have been designed in a way that we're really trying to prioritize and measure the things that matter most to families based on family priorities. And so the third part here is part C, is a series of caregiver questionnaires, which we'll send to you remotely before the conference, and we'll have you complete them actually prior to the conference. So it says 6/28, but we actually just changed that date to 6/24. So before your first research appointment, we're really hoping that you'll be able to complete these web-based surveys that will be sent to you on 6/15. And this is for a special reason. We want you to complete these questionnaires before the conference because we actually recently added some surveys for caregivers that we're also having clinicians complete at the conference. So we're going to ask caregivers to rate their child on certain behaviors like motor function, so how they're ambulating, how they move their bodies, how they're maybe using their hands, how they're communicating, how they're eating, if they're taking food by mouth or whether they're G tube fed or getting nutrition some other way. And then also how they're using their vision. But we're having clinicians at the conference do these very same assessments based on what they observe. And so we want to have you do them prior to the conference so that we can get kind of your answers before you talk to the clinician and before the clinician asks you questions. And this is because we hope to really expand our remote study in the future. And so we hope that there's, high agreement between what the clinician sees, in the session and then what parents are observing at home. So that's really the goal of that and the reason why we moved that deadline to before the conference. And we know that it's will be a lot to complete, in the week and a half before the conference, but I just wanted to explain that that's our reasoning. It's part of the research question. And so these questionnaires tap into things like development, problem behavior, gastrointestinal functioning, sleep, quality of life, and caregiver and family functioning as well. And what I want to mention, really importantly, is that if your child does participate in ALPS, we will be able to provide you with a research score summary for any standardized assessments. And so what this means is it's not a clinical report or a clinical evaluation where we would provide any diagnoses, but we would be able to provide you norm reference scores, so how your child's doing compared to other same age peers. And you can use that information, you can give that research score summary to school or your child's care team, and they might find it helpful, right? And so I just wanted to mention that that would be something that we would be giving you guys. And it takes a little while to put those together. So it wouldn't be like at the end of the conference, we'd be handing you this paper. We want to go back and look at the scores, double check our scores and make sure everything is accurate. And then we would send that to you. Okay, and just in our last few minutes, a couple of things to note. If you do participate in research, we're going to have a one-on-one meeting with you beforehand, but and we'll go over all of this, but very quickly, we do want one caregiver to come to the in-person sessions, and we want folks to bring items of interest to engage their child, right? So like if there's any toys or reinforcers or break activities that they enjoy or things to help them, with any frustration, we love for you to bring anything, like that to the sessions. And of course, we'll take breaks as needed. And all of our examiners are very skilled at working with children with developmental disabilities, really at all levels. And so, you can let us know when you need to take a break. And our clinicians are also keenly aware of, those signs of when it's time to take a break as well. Of course, bring any glasses, hearing aids, or other equipment like braces. If they use a wheelchair, if you can bring their tray, their activity tray, that would be great. So we can have, activities, at the appropriate level for them. Um, okay, so now I'm going to turn it over to Suhani, who's going to talk a little bit about the process, the research engagement process. You hear Suhani? Okay, great.
Hi everyone, my name is Sohani. Thank you, Natasha. Just to quickly introduce myself, I'm the clinical research coordinator here at UCLA, and I might have spoken with you more recently or before about the natural history study and more about the conference. And just wanted to go over the workflow that's happening and tell you about the next steps. The very first step is our initial screening call that happens with me, and some of you might have already done this, but this is where I walk you through the different studies that Dr. Natasha, Dr. Russell, and Dr. Wilson just mentioned, and go through the different consent forms with you, and also answer any questions that you might have and talk to you about the next steps. After that, I send you the consent documents over DocuSign on your email for you to sign. If the participant is eligible for the champion study, we have a small separate workflow where we ask you to schedule a parent interview. This is a phone call that happens with the parent, and the child does not need to be present. Um, but it's a parent interview with our champion team. And then these are scheduled closer to the date of the conference, so more towards end of May and closer to the June date of the conference. We'll be scheduling these. And once this is done, we ask all the families to complete something known as the conference preference survey. This is where we ask about the scheduling and logistics behind the conference. These can have questions regarding nap times for your child, if you and your caregivers or the family members that are coming would be interested in giving a skin or a blood sample, things like that. And once these consent forms and these surveys are completed, we go over a pre-conference interview with my other coordinator, Rachel. And this is a Zoom interview that happens. It's a 30-minute virtual interview. And this is so that we can gain more preliminary information about your child, just your child's abilities, communication, developmental profile, things like that, and also what you can expect during the conference with these research appointments. And once this is done, closer to the week of June 15th, we send over personalized conference schedules to each of you, so you can know the timings and research appointments that we have scheduled you for. And finally, the last step is you'll be receiving a questionnaire packet, and this has surveys that need to be completed before the conference, and the deadline to complete these surveys are June 24th. And I also just want to add, if I haven't reached out to you or you're interested in coming to the conference and have not done these steps, feel free to reach out to the email, the ASXL registry email, and I can get the process started.
Thank you, Suhani. All right, and last slide here. So I think Suhani talked a lot about what happened before the conference. At the conference, you just check in at the regular check-in, and the research check-in will be right next door. And so you'll receive a research packet with your schedule and instructions. But as mentioned, you're going to have your schedules the week of June 15th sent to you, so you'll know what to expect. And then after the conference, of course, we're going to have those remote interviews. And typically what will happen when you have the one-on-one call with my research assistant, Rachel Northrup here, she'll get your availability for those interviews after the conference. So we'll know when those will be as well. All right. And for the sake of time, I think we're done anyway. That was the last slide. So we have a couple minutes. I have to hop off right at 4, or Eastern. And so any questions for the research team?
I think the one before you depart, Natasha, was I think Sam's question in the chat was if two caregivers could be in those longer interviews. I think that was in relation to perhaps the longer communication and cognition assessment. And in your slide, it sounded like the only one parent could be in at a time
Yes.
to switch. Can you just offer some clarification on that?
Yeah, so ideally we'll talk if you are going to participate in the in-person data collection, like I said, we'll have a one-on-one with either me and my research coordinator or one of us. And we can talk about your specific needs, but typically we like to only have one caregiver in the room. However, if there's some kind of accentuating circumstance, maybe for supporting behavior or whatever it might be, or if the child does best with two parents, like we can make accommodations for that. We're going to work with you and whatever you and your family need.
Thank you. And then one of the other questions I'll direct to Dr. Russell was about who could give blood. I know we've got not just parents coming to the conference, but lots of other relatives, including aunts, uncles, grandparents. Can you offer some advice on who can contribute a biological sample?
Yeah, I think if anybody is coming in your group and they're interested in donating, let us know that. And we will certainly talk to you about whether or not that we will take a sample from them. We're trying to get as many as we can, but we will have some technical limitations as well. I would say we're most interested in what we call age match controls. So finding healthy siblings, for example, who are younger ages. It's harder to get samples from children, and we have better control data from adults. So the children are always sort of our priority when we're looking at unaffected family comparators. But tell us who's coming and who's willing, and we'll certainly work with you on that. We appreciate everyone who's willing to donate.
Great, thank you. And I know we're at the top of the time here. If you do need to drop off and still have some questions, you're welcome to email info@arrefoundation.org and we'll make sure your question gets routed where it needs to go. But in the meantime, I think those of us who can stay on can take a couple more questions here. Michelle, do you have a question? I see you're off mute.
I do have a question, and I'm sorry if this has already been addressed. So if we wanted to participate in some of the study sessions, can we choose certain ones, or is it kind of all or nothing with the exception of the skin and blood samples?
I'm going to defer that to either Dr. Wilson or Dr. Russell.
Or Rachel. Rachel, do you want to answer that?
Yeah, can you hear me?
Yeah.
Yes.
Okay. So on the conference research preference form, it asks, are you willing to participate in all 7 hours of research or less? So if you don't want to participate in all of those sessions, I would select less on there. And then in the one-on-one interview that I'll have with you, or Dr. Ludwig will have with you, you can indicate like your preferences. I will say yeah, I think the researchers also have preferences in, like
Okay.
what they want, but of course you don't have, research is always voluntary. You are, of course, able to participate in what you would like to participate in, and there's no
So
requirement to do everything.
which thank you. It seems like it's quite a commitment, and obviously you said you're flexible, and we don't know how our kiddos will respond. Something else I wondered, which probably goes without saying, any samples or videos, even simply videos that are taken. I'm sure that there's some sort of privacy that, like it doesn't ever get shared, or um, it gets destroyed eventually. How does that get managed, I guess?
Yeah, I can take that a little bit. So all of these studies go through a rigorous sort of ethics board review that we call the IRB. And the IRBs at the institutions at both UCLA and Kennedy Krieger have reviewed all of these protocols. And so everything that we're doing has already been evaluated through this sort of pathway where we make sure that data is collected ethically. And then we also have to really ensure security of the data. So we are still, just like when you go and see a doctor and have labs drawn or talk to your doctor at a visit, everything is HIPAA compliant. You've signed that HIPAA form every time you go to the doctor's office. Everything follows those same standards and some additional standards as part of a research protocol. So, and the videos, and for example, and all the recordings are all subject to the same level of security and how we store those. And through the consent process, you will see sort of the language in there about the security of the data and how we store that. Everything is sort of housed within UCLA and Kennedy Krieger, and both sites have all of the approvals in place for that data to be stored securely. But it is absolutely not shared publicly on websites. It's actually not shared with the ARRE Foundation either. It's shared only within the approved research network that is part of the study.
Thank you. I appreciate it.
Yeah. And the one thing I'll add to that, Michelle, is so I think that question that was just addressed was related to research. On the conference side, separate from research, we take a lot of pictures, we have video, we share the conference widely with the community. So if you have any concerns about photo or video being taken of your child, please connect with me and we'll make sure that we have some designation, on your badge or your child's badge to make sure that any photos that your family is in are removed. So if you could reach out to me about that, we can touch base about that separately.
Thank you.
Yeah, of course. And then there's a question in the chat that I'm going to defer to Rachel from Sam about. She says that her child gets overstimulated and is just asking about participating in the full swath. So Rachel, maybe you could just reemphasize again what happens in the pre-conference interview with you and how you can talk through those concerns with families at that time.
Yeah, during the interview, we kind of ask about your child's interests, preferences, behavioral concerns. That way we can best prepare our team to work with them. And yeah, if you have any concerns, you're welcome to express them and we'll make note of them so that we know ahead of time. And yeah, that's like your time to ask specific questions and um, we can give you individualized answers.
Great. Thank you. And I think the the logistics nerd in me stops to appreciate, right, that we have all of these families and all of these different research appointments and all of these, needs that each family has. And this is one of the incredible things about this feat that we pull off at this conference is helping to match people to time slots that meet needs across the board. And I think that's just one other reason why we ask if you are interested in participating in research to start that process soon so that we can make sure that as we are building this incredibly complex 4D puzzle of people's arrival dates, departure dates, best times, that we have every bit of information we need to help the research teams plot that out accordingly to meet everybody's needs. And it is an incredible effort that this really collaborative team puts together. So that is both my little plug for reaching out to the research teams ASAP and also just appreciation for what goes into pulling this off in a really cool way.
Yeah, I second that, Amanda. I also just wanted to put Sam's mind at ease. She had mentioned being a scholarship recipient, and that as a scholarship recipient, you're involved in some of the research, but that is specific to the severity assessment workshop that's happening Saturday afternoon, and that would not involve your child. So that's not child-related assessment, the part that's connected to being a scholarship recipient.
Yeah, thanks, Sarah. That's great clarification. Great. Well, I think, Sarah, do you want to wrap us up and send us off into the future here? And wind, you're so good at this. I'm gonna let the pro handle the wrap up.
Oh, well, I just have to say I am just so excited for this conference. Both as a parent, the honor and privilege it is to connect with other ASXL families is just beyond a dream. The first time I met another Shashi Pena parent was in 2024. So Sam was 9 years old, and that was just an incredible moment to meet someone who understood our journey, and it just felt like we were meeting family. And then beyond that, to be a part of research, in-person research, is such an incredible opportunity. Like I always say, when we first got our diagnosis for Sam, we knew absolutely nothing. We didn't even know if his ASXL2 mutation had anything to do with all of the very complex medical things that were going on in his life. And to be on this side of things, we're not only do we know that, but we're able to make these connections. And we have these incredible scientists and researchers and clinicians who are committed to helping our kids and moving research forward and answering the questions that keep you up at night. By participating in this conference, you are part of that and you are leading the future. And I'm so excited. So thank you so much for being part of this conference, and a huge thanks to our researchers who are absolute rock stars. And I love you all.
That's why I had Sarah do that, not me. Well, we look forward to seeing everybody in Michigan. And if you have any questions, please reach out. If you're not sure where to start with your question, I would say shoot it over to us at the ARRE Foundation. You can either email Sarah directly, sarah@arrefoundation.org, or if it's easier to remember, just info at Sarah and I check that inbox together. We will route your question where it needs to go. And we look forward to seeing you in Ann Arbor at the end of June. Thanks,
Awesome.
everybody.
Thanks, everybody.